Everyone, we are all welcome to this evening's broadcast. Welcome to every one of us. How is our week going? I hope our week is fantastic. Well done to every one of us, and I hope we're keeping fit. This is the second to the last month of the year, and I hope you're checking your 2021 what do they call it now, what you wanted to achieve, your goals and your objectives for 2021. God is still able. Our God is a God of one day. You can still hit your target. So don't give up. Don't give up yet, okay? You're welcome. We're all highly welcome to this evening's broadcast. Today, we're going to be looking at the remaining 5 parts of the common types of arthritis. But before I even go through the remaining parts, I'll still try to go through, just mention them. The first parts that we had done earlier this week on Monday. So if you've joined me live, you can just say good evening so I can welcome you to this evening's broadcast. Welcome, and please share. A lot of people shared last week one. And I want to say thank you to every one of us that shared. We already have more than 100 people that shared last week on. So why don't you share to your friends so that they can partake of this, also essential and also important topic about 10 common types of arthritis. And remember what I told us, when you know what is wrong with you, then you will be able to know what to do about it. And that's also very important. Especially for arthritis, you actually need to know which type of arthritis you're having to be able to know what to do about it. I was talking with someone today, and when she just saw my video on arthritis, she just said, "Oh, I wanted that thing you talked about." So I said, "Are you sure it's arthritis you have?" She said, "Yes, it's arthritis." So I sent her the 2 supplements. And then she finished using them and said, it didn't work for me like you were saying. So I said, okay, let me now ask you very well. So I started asking her some questions, one after the other. And I found out that it's not really arthritis that she had. So I want us to know that every pain is not arthritis. Every pain is not arthritis. And you need to find out, even if it's arthritis, what type of arthritis. Because if the arthritis you're having is due to lack of blood flow, when the blood flow is hindered, or if it's a matter of nerves, because sometimes you can have some kind of nerves issue from your waist, your lower waist, and that supplies blood to your knee. If you have issues with the nerve there, it's going to affect that joint, your knee joint. And then if you go ahead to treat just that symptom of the pain on the joint of your knee, you will still be having that pain. So we need to also handle the nerves. So that was what I found out with that woman, and she's okay now, because I had to also give her what would handle the lack of blood flow and also help to, heal the nerves, so that she will be able to get all the nutrients, all the blood flow flowing well to where it's supposed to flow for her to be okay. So essentially what I'm saying is this, that you need to know the type of arthritis you have, you need to know the symptoms, you need to know the causes, you need to know how it started, so that you will be able to, explain very well, and then we'll be able to tell you, okay, this and this are what you need to do about it. So that's why I'm taking my time to make sure that we deal with the common types of arthritis. Like I told us, there are over 100 types of arthritis, different. In fact, when you come to the children's section, the juvenile, there are about 6 different types. I'll just read through them today, but today we'll handle the juvenile arthritis. We're going to look more deeply into it, okay? All right. So we are highly welcome. I hope you've shared. If you've not shared, make sure you share with your friends, so that they will be able to join us today and also gain in what we're doing today. So I'll just put off my voice, and then we get going. Today, and then I handle this in a way that I'll be able to. What is wrong with you? To see us. You'll be able to know what to do about it, and that's also very important. Sorry about that. Hello, Angie McKay. Welcome to this evening's broadcast. Welcome, Doris. Doris, you're welcome. Welcome to this evening's broadcast. So let's share. Yes, a lot of us have already shared already. And if you've joined online, you can greet, so I can greet you and welcome you. Hello, Evarista Ijoma. You're welcome to this evening's broadcast. Welcome to every one of us. So like last week, we looked at arthritis generally, and I told us that arthritis is an inflammation of the joints that can cause serious pains or mild pains. And I told us that there are up to 100 types of arthritis. And I also told us that the arthritis affects quite a large, percentage of human beings here on earth. And then I said that there are 10 common types of arthritis. We have like 10 common types of arthritis. Hello, Opeyemi Idowu, you're welcome. Welcome to this evening's broadcast. We have the osteoarthritis 1, rheumatoid arthritis 2, psoriatic arthritis 3, gout 4, lupus 5, juvenile arthritis 6, Spondyloarthropathis 7, infectious and non-infectious 7 and 8, arthritis. Then we have thumb arthritis and ankylosing spondylitis. Okay, all right, so we looked at osteoarthritis, rheumatoid arthritis, psoriatic arthritis, gout and lupus on Monday. So if you want to hear about them, know about them and check their symptoms, please watch Monday's videos. Just go on my page, Aging with Grace, and you'll be able to see the videos I've done and you can watch them. So today we're going to go straight to the Spondyloarthropathis. Okay, hello Mary Zane, you're welcome. You're welcome to this evening's broadcast. All right, so I'm saying when we talk about the Spondyloarthropathis, there are different types. We also have the ankylosing spondylitis, and then we also have all these ones we're going to mention today. Most of them are under it. We have psoriatic arthritis that we have looked at before. We have reactive arthritis. We also have enteropathic arthropathy, which is also associated with the gastrointestinal tract. We also have the acute anterovertis, and then of course the juvenile ankylosing spondylitis are also all included in this section. So when we talk about spondyloarthropathis, it can attack the peripheral joints, such as your hands, your feet, anywhere that is like an ending sort of your body, like the hands, like the feet. And also when we talk about the ankylosing spondylitis, the bone fusion may occur, causing deformation, especially of the spine, and also dysfunction of the shoulder and the hips. So when this occurs, it's like a bone deformation, and then one you will find out later when we'll be talking about it. It might cause some people to bend, some people to bend in different directions depending on where the deformation of the bone had occurred. Hello Mary Zane, you're welcome to this evening's broadcast. So when we talk about ankylosing spondylitis, it's an inflammatory disease, and that over time it can cause some of your small bones to fuse, like the vertebra. When we talk about the spine, the vertebra, they will fuse together, and this fusing will make the spine less flexible. It's like it becomes stiff, and then it can result from people having this hunched forward position. The person won't be able to move very well, the spine. And then if it's the ribs that is affected, then one will find it difficult to breathe. One will find it very, very difficult to breathe when it's the rib that is affected. Hello Grace, you're welcome to this evening's broadcast. Now when we talk about ankylosing spondylitis, it affects both men and women, and the signs and symptoms begin at early adulthood, like from the youth. That's when one begins to see the signs and symptoms of ankylosing spondylitis. And then the inflammation also occur in other parts of the body, like the eyes. The person will begin to have swollen eyes, and there is actually no cure for ankylosing spondylosis, but it's just management that is done so that one will reduce the symptoms, reduce the progression, which is very, very important. Reduction of the progression is also very, very important, and that's why when one would need to be very, very careful about it. Hello, Eteng Marianne, you're welcome. Welcome to this evening's broadcast. Now, let's look at some of the symptoms. Early symptoms of ankylosing spondylosis include pains, stiffness in the lower back and the hip, especially in the morning or after, when one has stayed in a place where you have stayed, maybe like when you wake up in the morning, or when you sleep in the afternoon for a long time, or when you have stayed in a place, maybe sitting down for a long time to watch television. You will just have those lower back pains and have that stiffness. And then it also comes with a kind of neck fatigue, you know, and over time these symptoms will worsen. They will be becoming more and more serious, and that's why the management is very, very important. It's very, very important that anybody that is having ankylosing spondylosis manages it very well, so that it will stop the progression of that disease. All right, so what causes ankylosing spondylosis? You know, researchers have not found out the specific cause, but they also looked at the fact that it can be genetic, especially people who have the gene called HLA-B27. You know, they are greatly at a very serious and increased risk of developing ankylosing spondylosis. And also some people may also have, people who don't even have that gene can also develop the condition. Hello, Alabifumilola, you're welcome to this evening's broadcast. Now, some risk factors that are associated with it are, if your sex, men are more likely to develop ankylosing spondylosis than women. Then age. The onset generally occurs in late adolescence and early adulthood, and that's why they say some children would, especially some children who are into sports, they will begin to say, oh, they are having arthritis, they are having arthritis. It's actually ankylosing spondylosis that they are having. Then also it is hereditary. Most people who have ankylosing spondylosis have the HLA-B27 gene, but many people who have this gene sometimes don't even develop it. So it's not as if once you have the gene, you will have the disease. No, it doesn't follow. Hello, welcome, welcome, Philomena. Welcome, Alabifumilola. Welcome, Olatunde Felicia, to this evening's broadcast. Let's share. Let's share with people. Let's share with many people so that they can join us this evening for this evening's broadcast. Okay? So there are some complications that might arise in ankylosing spondylosis, and that is when new bone forms as part of the body's attempt to heal. You know, when the body notices any disease, it tries to fight it. So when your body is trying to fight that disease, then some bones will begin to grow, and this new bone will gradually bridge the gap between the vertebra, and eventually it will fuse the section of the vertebra. And that's why the person becomes stiff, as if you will not move. So those parts of your spine become stiff and inflexible. Okay, and the fusion can also stiffen your rib cage, restricting your lungs capacity and function, and the person will begin to have one kind of, you know, lung disease or the other. Also, other complications are eye inflammation. You know, one of the most common complications of ankylosing spondylosis is rapid onset of eye pain, sensitivity to light, and blurred vision. It also comes with it. Remember when we were treating rheumatoid arthritis, I also told us that it can develop kind of eye issues. Okay, so you need to quickly see your doctor when you suddenly begin to have eye issues, eye pain, your eye is paining you, you're being very sensitive to the light, and the person is having blurred vision, and that, you know, like children who are like 18, 19, 16 years old, having suddenly coming to complain about that, then we need to actually take them to the hospital to ascertain the fact that that is not what is happening to them. Hello, Olatunde and Doris. You're welcome to this evening's broadcast. So, some other symptoms are like compression fraction. Some people's bone thin during this early stage of ankylosing spondylitis, and then they have weakened vertebra, which could crumble, increasing the severity of the stooped posture. You will just find out that day by day the person is bending the more. So this vertebral fracture can then put pressure on possible injure the spinal cord and then the nerves that pass through that spine. Remember when I was starting, I told her that sometimes when you're having joint pain, it's not actually because of the wear and tear of the bones, the wear and tear of the cartilage. It might be because it's a nerve problem. It might be a nerve issue that is occurring. So you need to actually know what is happening to you. And then another complication that comes with ankylosing spondylitis is heart problems. You know, it can cause heart problem with the aorta, that is the largest artery of the body. And then when the aorta is inflamed, it can then enlarge to the point that it distorts the shape of the aortic valve in the heart, and which can also impair its function. So, like I said, prevention is better, prevention is safer, prevention is cheaper than cure. And I need to warn us here, when you begin to have early symptoms, it's better for you to actually manage and treat whatever you're having if you've not prevented it. But if you allow it to grow and extend and it becomes very, very, bad, then you might not be able to reverse such conditions. So it's very, very important for us to start early. You know, they will say catch them young. You need to actually start early. So the 7th type of arthritis we're going to be looking at today. Thank you for the thumbs up. Thank you for the love. I appreciate every one of us. The 7th type of arthritis is the infectious arthritis. Now, the infectious arthritis are also called septic arthritis. They are also called septic arthritis, and is a painful infection of the joints. You know, infectious arthritis is an infection in one of your joints that causes pain or swelling. And the infection can be caused by bacteria, by viruses, by parasites, or by fungi. So it could be any. Of course, we know that these 4 things are the things that could cause infection in our body. It could either be bacteria, it could either be viral, it could be parasites or fungi. And you know, it can start in another part of your body and then it will now spread to your joints. Like infection-causing germs may also enter your body during surgery, or when one has an open wound, or when one takes injection. So if one gets germs, it may be bacterial infection or fungal infection during that time, it can now grow and spread to your joints. So when they grow and spread to your joints, that's when it's called infectious arthritis. And this kind of arthritis is often accompanied by fever and chills because of infection. Of course, we know that when there is infection, there is always fever and there is chills accompanied with it. So now, what are the causes of infectious arthritis? What are the causes of infectious arthritis? All right, infectious arthritis are caused by bacteria, like I said. And if it's bacteria, the most common is the Staphylococcus aureus, or they call it the staph, a bacterium that lives in a healthy skin. So infectious arthritis can also be caused by virus or by fungus, okay? And in most cases, infectious arthritis develop when an infection somewhere, like I said, somewhere else in the body, it will now travel through the bloodstream to the joint. So when it now gets to the joint, it can now begin to cause that infectious arthritis. But less commonly, the infection can enter the joint directly through the puncture wound or surgery or near that joint. So what am I saying here? Hello first. What am I saying here? When you have wounds, you need to handle that wounds very, very well. I have on my table. When you have wounds, you need to handle the wounds very, very carefully. Don't take a wound serious, saying, oh, this one, you will leave it. especially when we are already growing at our older age. We need to be very, very careful. And remember what I talked about, the infectious arthritis. It can affect anyone. It can affect anyone. So when you have wounds, it's better for you to treat that wound very well. There is one of our products that I always advise for every home to have in their nearby. Like this one now, I just asked for it and they picked it from my table. Is the Aloe First. Aloe First. Our Aloe First is a fantastic way to prevent infection when you have wounds and cuts. So when you just have wounds and cuts, it comes with a spray. What do? You just spray. You just spray it on the wound or a cut. Even sometimes when I have mosquito bites, so that I will not take my finger that I don't know what I have touched with to go and start scratching that part of my body. I will just spray. Even on my hair, I still use my Aloe First on my hair. You know, because sometimes when they are making your hair, sometimes they pull it in a way that it injures. So anytime I feel I have an injury on my hair, I'll just, you know, in that area, I'll just spray my Aloe First in that place and just allow it to dry on its own. So this is very, very good that we can use as a preventive measure so that you will not have all those infections coming your way. All right, so what are the symptoms of infectious arthritis? The symptoms of septic or infectious arthritis usually come rapidly, and they include swelling, pain, fever, and chills. Infectious arthritis typically strike the knee, the hips, and the ankles, okay? And also the wrist may be affected sometimes. You know, most times the infectious arthritis are more than one, they affect more than one joint, you know. So septic or infectious arthritis is extremely painful and can develop quickly, suddenly. And is a very, very serious condition when it's, because of course we know that septic arthritis, even when they say that a wound or a sore or, you know, somebody's whatever becomes septic, it's very, very important that the person is rushed to the hospital. It's actually an emergency case, okay? Hello, Tinwa. Greetings from Cameroon. You're welcome. Welcome to this evening's broadcast, Tinwa, all the way from Cameroon. So that's our number 7, infectious arthritis. Then number 8 is reactive arthritis. Number 8 type of arthritis out of the 10 common arthritis we're going to be looking at today is reactive arthritis. Reactive arthritis can occur when an infection in one part of the body triggers your immune system dysfunction and then inflammation in a joint elsewhere in your body. So watch it now. When we talk about infectious arthritis, it is when the infection moves on its own and goes to attack any joint of your body. But when we call it reactive arthritis, it then is not just moving on its own, it triggers your immune system. And then there is an inflammation. And this infection often occurs in the gastrointestinal tract, in the bladder, or in the sexual organs. That's where the infection usually, you know, starts and attacks from. Good evening, Ojitaju. You're welcome to this evening's broadcast. Welcome, 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 Serifat Bennett. You're welcome to this evening's broadcast. I hope I greeted every other person. All right. So when we talk about reactive arthritis, you know, reactive arthritis is joint pain and swelling that is triggered by an infection in another part of your body. Most often, like I said, your intestine, your genitals, and your urinary tract. So reactive arthritis usually targets your knees and the joints of your ankle and feet. That's where they target. And then inflammation also can affect your eyes, your skin, and of course your urethra. Remember I said that sometimes it develops from there. You know, previously reactive arthritis was sometimes called rectal syndrome, which was characterized by eye, urethra, and joint inflammation. So what are the symptoms? What are the signs and symptoms of reactive arthritis? Now, the reactive arthritis can start up like 1 to 4 weeks after exposure to those infections that I talked about. It takes like 1 to 4 weeks to be able to affect the immune system and then cause this reactive infection. And the symptom usually comes with pain, stiffness. The joint pain, you know, is associated with the pain on your knee, your ankles, and your feet. And also, you might also feel some pains on your heels or your lower buttocks, okay, when one is having reactive arthritis. Hello, Ego. Welcome, Jane. Welcome, Titiloa, to this evening's broadcast. Now, some other infections, symptoms that comes with reactive arthritis is eye inflammation. Many people who have reactive arthritis also develop eye inflammation or conjunctivitis. All right, urinary problems also occur, which is increased frequency and discomfort during urination, and also inflammation of the prostate gland or cervix. If it's the man, the prostate gland; if it's the woman, the cervix. Then also the symptom is also low back pain. The pain tends to be worse at night or in the morning. Now, why am I talking about reactive infection? I had a case of someone who was insisting that it was arthritis that was happening, and I kept telling her, because you're having chills, because you're having cold, and because, you know, this thing started suddenly. If it was rheumatoid arthritis, it would have stayed for some time, but that this thing suddenly started. It's arthritis, but it's not like osteoarthritis or rheumatoid arthritis. It's reactive arthritis. And when one is having reactive arthritis, you need to treat infection. You must take the supplements that or the drugs, if you want the option of taking traditional medicine that can drugs that can actually target infection. Okay. Now, also some of the symptoms of reactive arthritis is infection of the soft tissues where it enters the bone, and this might include your muscle, your tendons, your ligaments, and then it can come with swollen toes, swollen fingers, and in some cases your toes and your fingers might become so swollen that, you know, they become so fat like this. If it's the Oyibos, they will say it's almost like sausage. Then also it comes with skin problems. Reactive arthritis can affect your skin in a variety of ways, including rashes, or the sole of your feet or your palm will have some kind of sores on them. All right. Also, now let's look at what causes reactive arthritis. Reactive arthritis develops in reaction to an infection in your body. It's a reaction. That's why it's called reactive arthritis. It's a reaction to an infection. It could be in your intestine that you're having that infection. And that's why it's very, very important, Pro B. That's why it's very, very important for us to make sure that our colon health is very, very important. You need to be sure that your colon health is very, very important. So you might not, it can also be infection from your genitals. It can also be infection from your urinary tract. So you might not be aware of where the triggering infection is coming from, but it can also be mild, and it can also, you might even not have any symptom when it's developing. The numerous bacteria can also cause reactive arthritis, and that's why I always talk about people having good flora in their guts. What do I mean by that? Where in our stomach we have the good bacteria and we have the bad bacteria. It's always in everybody's stomach. The good and the bad bacteria is in anybody's stomach. So, but when the bad bacteria, you know, overpowers the good bacteria, then that's where you can have infection that can cause reactive arthritis, an infection that can cause ulcer, infection that can cause digestive problems. But when your good bacteria overpowers the bad bacteria, then that's when you have what we call the good colon health. Okay? And there is one powerful supplement that I always recommend for everyone. It is Pro B. This Pro B is very, very important for children, for adults. It's something you need in your family. Pro B has 6 strains of the good bacteria. And what happens? You know, these good bacteria strains or probiotic will now combine with, because it's combined with probiotic factor to support your intestinal flora and then it will now balance and promote healthy digestion for you. It will enhance your nutrient availability and also support your immune system. How it does this is by overpowering the bad bacteria in your system and also improving and increasing your good bacteria. So this one supplement that anybody that is having any form of digestive issues, any form of infection, should actually make sure they have. And then reactive bacteria can also be caused by sexually transmitted diseases and also foodborne. It could come because when somebody eats poisoned food that is not well cooked, that has a little, you know, infection in it, it can also come. Reactive arthritis can also come through there. Hello Jane Uche, you're welcome. Welcome Ego Nzekwe. Welcome Titilayo to this evening's broadcast. So some of the common causes, if we are looking at some of the bacteria that can cause, or fungus that can cause this, is so many big names. I don't know if we need to go through them. They have the chlamydia, salmonella, Shigella, and the rest. So reactive arthritis actually isn't contagious, but the bacteria that causes it can be transmitted sexually, or it can be contaminated. It can be gotten from contaminated foods. Okay, so only a few people actually can be exposed to this bacteria. Who are exposed to this bacteria actually get it, but it still occurs. So prevention is still better and safer than cure. So what are the risk factors of reactive arthritis? Age is one of it, because it occurs frequently between ages 20 to 40. So people who are between ages 20 to 40 should be very careful about it. And that's why I talk about the young adolescents and the young adults in having the reactive, arthritis. Then women and men have the same equal whatever to it, but it's more likely to occur in men than in women. Also, it's hereditary. A specific genetic marker has also been linked with reactive arthritis, but even though somebody might have that gene and not still develop it. Then how do you prevent reactive arthritis? The genetic factor appears to play a role in whether you are likely to develop reactive arthritis. Though you can't change your gene makeup, but you can reduce your exposure to the bacteria that might lead to reactive arthritis. So number one, make sure that your food is stored at proper temperature. Like there was something some people do. You will finish cooking your food, and before the food is cooled enough, you carry it like that and put inside the freezer, especially for those of us in Nigeria. And then NEPA takes light. When NEPA takes light, the food does not cool immediately. So you're having cool and heat in the freezer, and then that food begins to form little mold that you cannot see. Then you bring it out from the freezer, you don't warm it very well. That food can get contaminated. And when it gets contaminated, then somebody can begin to have infection in the intestine, which can lead to reactive arthritis, okay? So it's very, very important that we handle our food very well. Cook your food very well and avoid many, foodborne bacteria that can cause reactive arthritis. And then also, now let me also sound this warning. Sometimes we can't help it. We have to take food where we didn't plan. Like when you go for parties, you're not very late at that, just join. You can watch the replay later. Like when you go for parties and they give you food, you will not say you will not eat. Or maybe you're working in the office and it happens to be that your what is it called? You have to eat food that you have already put in your bag, and then maybe it's getting a little bad, and then you still have to eat it, nowhere to warm it. Now, what I tell people, one doesn't need to be very, very afraid all the time. You don't have to be very, very afraid all the time. And that's why daily detoxification is very, very important. Usually when I have people I do menu plan for, or people I'm taking through going from a bad or not so good healthy living to a better healthy living, I always put for them first thing in the morning what I call your morning detox. You have to do your morning detox. Now I want to show you what a morning detox looks like, because that's what prevention is better and safer than cure. When you're looking at how to cure, when you're looking at not having digestive issues, when you're looking at having all those free radicals in your system and in your body, trying to make sure that you live a life that is free from every form of oxidation, trying to live a life that is free from every form of oxidation, then you need to do your early morning detox. Your early morning detox is very, very important. So what's your early morning detox? Let me now tell us. First of all, when you wake up in the morning, what do? You take your probiotic. I'm going to open this Pro B. I'm not going to drink it because I'm taking my morning dose, but I'll just tell you, I'll just take some water. This, okay, I can just take another one. It's demo. It doesn't really feel no real overdose of it. All right, so this is my Pro B now. So this is my Pro B. So when I wake up in the morning, what do? I take my Pro B, and then I take it with 1 full bottle of water. I drink a lot of water, and water is very, very essential for us. So I'll keep taking my Pro B with my water. So as I'm taking it with my water, I'll take it all through. As I'm taking it, I'll just, you know, as I drop my bottle, I can do my prayer and whatever I'm doing. Then like 20 minutes after, I take my aloe vera gel. I open my aloe vera gel after taking my water. This is a new aloe vera gel. I open my aloe vera gel again. Our aloe vera gel is very well sealed. It's very, very well sealed. So I open my aloe vera gel and I take, like, let me show us the quantity you should take. I'm trying to shake. So this is the quantity, the least you should take every morning of your aloe vera gel. Okay, now I take my aloe vera gel. And then I continue with my water. Now I took mine before it's 20 minutes. When I'm having constipation, I don't wait for it for 20 minutes before I take the aloe vera gel. I take it like 5 minutes after. Now I want to show you what happens in my system when I'm taking this thing. I have a kind of detox, and if you do this every morning, you're safe for the day, no matter what you take. And then last thing at night, I'll still take my aloe vera gel like that in the bottle. I'll still take my aloe vera gel like that, you know, that same quantity that I took. I'll still take it last thing at night before I sleep. So now let me demonstrate to us what happens in my system when I go out. I take this as the blood in the system. Okay, this water is flowing like the blood in my system. So as this water is flowing as the blood in my system, and then I'm going to show you, if I go out and then I have free radicals, I have all those, maybe I've eaten a food that is contaminated, maybe I've gone to a restaurant, I was very, very hungry and I took that food, or I was in an office and then I had the generator that was just there booming, you know, these represent all this. Okay, that's like, they always say that iodine is one of the strongest oxidative agents. Okay, so this is like the generator smoke and all that is coming, and then they come into this and they contaminate my body. You see, it's looking contaminated. Can you see it? I hope the color has changed. Yes, contaminated. Okay, now because I have taken aloe vera gel, contaminated in my system, and now because I've taken aloe vera gel, I'm going to take it in the night. I'm going to demonstrate what happens. Let me just even take a capful of this. I'm not putting the full dose that I have taken into that. So I take like a capful Can you see what is happening? It starts going down to wherever those oxidative effects has taken place, and it begins to cleanse them step after step. It begins to cleanse my system. It begins to all from deep down. Remember, that's one thing that supplements will do for you. That's why they are not like drugs. They are not like drugs. They are not like medicine. They go deep down to begin to work on your system. And you can see, and it goes from inside out, coming from inside out, making you cleaner and cleaner, you know. Now, let's take, for example, this one is still contaminated, and you're still going about. As long as that one enters into this, it begins to cleanse. It begins to cleanse, and that's how you become clean all through. So this is what aloe vera does for you. This is the exact thing aloe vera does for you. So when we are talking about reactive arthritis, talking about ulcers, talking about infection, it's very, very important that you detoxify your system every day. That you detoxify your system every day. That's what all these things will do for you. So prevention is safer, is cheaper, and better than cure. Thank you for the thumbs up. Happy new month, Margaret. Alba, you're welcome. Oh, your birthday month to 11/11. Wow, Margaret, happy birthday in advance. It's my birthday month too. You're going to be hearing about my birthday later. All right. So prevention is safer and better than cure. So make sure you stay safe. Take your aloe vera gel first thing in the morning, your quarter glass, last thing at night, to also be sure that no matter what happens, you're safe. Then the ninth type of arthritis we're going to be looking at today, the ninth type of arthritis is the thumb arthritis. The thumb arthritis. Thumb arthritis is common with aging, and it occurs when the cartilage, you know, your thumb cartilage wears away at the end of the bones that form the joints at the base of your thumb, like here or here, okay? Mainly here at the end of the base of your thumb. So thumb arthritis can also cause severe pain, swelling, and decreased strength and range of motion, making it difficult to do simple tasks such as turning your doorknobs or opening some jars, like, you know, when you want to open some jars, like what I did now. You know, mainly is our thumb that we use in opening jars, so it might make it difficult for you. And then the treatment generally is involved in a combination of medications, you know, that can help the splints of the thumb. Then the pain, the symptoms is that it comes with pain, and that's the first symptom of thumb arthritis. Hello, Ada. Good job. Thank you, Ada. Joy Osiri, good evening. You're welcome. Mavis, Mali, you're welcome. Welcome to this evening broadcast. Then the pain can occur at the base of your thumb when you grip or grasp or pinch an object, or you use your thumb to apply force. And you know, sometimes it starts gradually and you will just feel, oh, it's just you're just feeling pain. Ordinarily, you're just feeling pain. But it's very, very important that you, like I tell us, study your body so that you can know your body and watch your body. Then other signs of symptoms might be swelling, stiffness, tender at the base of your thumb, and then decreased strength when pinching, like I said before, decreased range of motion, and then sometimes that bone can be enlarged in appearance. It will look as if the bone is bigger than normal, especially at that joint end. So what causes thumb arthritis? The major cause of thumb arthritis is age. And again, if one has had like previous trauma or injury on the thumb, you know, and then in a normal thumb joint, the cartilage covers the end of the bone, acting as a cushion and allowing the bone to glide smoothly over each other. But when there is thumb arthritis, that cartilage that covers the end of the bone, it's now deteriorated, and then the bone to bone is touching itself. So that's the main thing that causes thumb arthritis. Then also the damage to the joint might also result in growth of new bone, like I told us in ankylosing, you know, spondylosis. It can also come because of new bone that will come as a bone spur at that edge, and then you will begin to feel that why is my bone becoming as if an extra bone is coming up there. Then also other risk factors that you can have for thumb arthritis is it happens mainly to women. I think it's because we use our hands and our fingers a lot in the kitchen. Then when one is above 40 years, and then if one is overweight is another thing that can cause clinine. Overweight is another thing that can cause thumb arthritis. Then also some hereditary conditions such as joint ligament, laxity and malfunction of the joint can also cause joint thumb arthritis. Then the risk factors, you know, is including if you've had osteoarthritis before, or if you've had rheumatoid arthritis before, or if your job is the type of job, the job you do, you have a lot of activity that have high stress on the thumb, that could cause it. But generally speaking, people who are slimmer will not actually have joint arthritis, except if it's through wear and tear. And that's why I always tell people, if you're overweight, please reduce your weight. I remember our clinine is still going on. In fact, 2 people joined the team again today. Mrs. Lawal joined the team again, and Lizzie also joined. She's even calling me this evening. I'm sure she has a question that she needs to answer. She forgot I was supposed to be online. So get your clinine pack, and you will still get 2 free bottles of aloe vera gel. If you buy 1 pack of clinine, you get 2 free bottles of aloe vera gel, so that you'll be able to go through that, you know, the program very well. Well, it's about to rain. I might stop. Then the 10th type of arthritis. Hello, Joy Osiri, you're welcome. Welcome for my Iwoma carry to this evening's broadcast. The 10th type of arthritis is the juvenile arthritis, the JA, the juvenile arthritis. Now, when we finish these 10 types of arthritis, we're going to take the most common ones. I'm going to give us a graph of the most common ones, and we will start with those ones. In case we are not able to finish them by the end of the month, we would have taken the most important ones. So, juvenile arthritis is an umbrella term for several types of arthritis that affect children, okay? And the most common type of juvenile arthritis is what they call the juvenile idiopathic arthritis, or the GIA, the juvenile idiopathic arthritis. Now, this group of arthritis are autoimmune disorder that can impact the children's joints. They are autoimmune disorder that can impact the children's joint. The juvenile arthritis also affects so many children, hundreds and thousands, or even up to millions of children in the world, according to Arthritis Foundation. Now, there are 5 types of juvenile arthritis. The first one is the juvenile dermatomyositis. Okay, and then we have the juvenile lupus. Just like lupus happens to adults, lupus can happen to children. Then we have the juvenile scleroderma, and then we have the Kawasaki disease, and then we also have the mixed connective tissue disease. Those are the 5 types of arthritis that can happen to children as juvenile arthritis. I'm going to take our questions, and then we'll call it a day very soon. But I just want to quickly go through juvenile dermatosis, because that's one of the most common type of arthritis that happens to children. Now, the juvenile dermatosis is a rare childhood disease that can cause muscle weakness and skin rashes. It causes muscle weakness and skin rashes, and it's also a complex disease. Remember that I told us that it also causes inflammation of the blood vessels. It causes inflammation of the blood vessels. It can cause muscles, inflammation in the muscles. It can cause inflammation in the skin. Okay. But one good thing about it is that it's a treatable disease. And in many cases, the disease goes into remission. Within 2 years, it will disappear. So it's not something one should really worry so much about. Then also, we also have the juvenile lupus. Now, the juvenile lupus, also known as the juvenile systemic lupus, is an autoimmune disease. This is also very, very important that we look into it very well. It's an autoimmune disease where the body produces antibodies which attacks its own cells, and then it causes inflammation in the subsequent damages to multiple organs like skin, like joints, like kidney, like nervous system, the heart, and the lung. So children with lupus may experience symptoms like red rash on the cheek or the bridge of the nose. They will have red rashes here or on their cheek. You just notice a lot of red rashes. Then they can also have like a disc-shaped rash, you know, that is like disc, like this, in so many patches of their, you know, their skin. And then also they can have skin rash if they go out in the sun. They can have skin rash. And then they can also have arthritis in more than one joint, maybe their fingers and their toes. And also, if it's left untreated, it can go on to the heart and the lungs, and then the child can develop kidney problems. So it's very, very important that juvenile arthritis are also looked into. Then the third one is the juvenile scleroderma. And this juvenile scleroderma is a condition in which the skin becomes unusually thick and hard. The skin becomes unusually thick and hard, you know, and it's also an autoimmune disease. And then the person's system causes inflammation of the skin, and the inflammation can also trigger some connective tissue cells to produce too much collagen. You know, for us, when we are getting older, we're talking about not producing enough collagen, and then the skin becomes very thin as if it's going to break. But for when somebody has juvenile scleroderma, it produces too much collagen, and then the skin becomes very, very thin. It's like an inflammation, okay? And then a fibrous protein is also that has a major part in many tissues is also produced. So that's it. Then the fourth one is the Kawasaki disease, and the fifth one is the mixed connective tissue. Those are all the kind of arthritis that come with juvenile arthritis. So if you're experiencing joint pain, stiffness, or other symptoms, you need to quickly do something about it. Go to your healthcare provider, go to your doctors, talk to someone who is experienced about it, and talk about those symptoms. If you're having a lot of symptoms, like I told us, you need to know what the symptoms are before one will be able to say this is what is happening to you. You need to be able to describe the symptoms you're having. Please, I'm begging us. So when you call, don't just say, I'm having knee pain because of this knee pain. Try to remember, when did the pain start? How is it doing me? Is it giving me fever? Is it more in the morning? Is it more in the afternoon? Is it coming with headache? You know, you need to actually understand what is happening to you. That is what could help one to be able to find out any help that you can be giving. All right, so I'm going to take our questions now, and then we call it a day today. So those are the 10 types of arthritis, common types of arthritis. Remember, we have treated the 10 common types of arthritis, which is osteoarthritis, rheumatoid arthritis, psoriatic arthritis, lupus, juvenile arthritis, spondyloarthropathis, infectious and reactive arthritis, thumb arthritis, and ankylosing spondylitis. All right, these are the 10 we have looked at. You can chat me on my number, which I'm putting on the screen, if you have some more questions. It's trying to rain very, very well. Yeah, I might not be able to hear you in a few minutes from now. +234 703 515 1642. +234 703 515 1642. So you can chat me on my number if you have more questions. Please call me if you have more questions, so that I can answer your questions, you know, because the rain might cut us off. Of course, we know Nigeria, what happens in Nigeria when it rains. And I don't want to be thrown out of here rudely. So I'll just quickly check if we have any question, and then we'll call it a day. If I didn't greet you, please, I greet everyone. be greeted. No questions. If there are any questions, chat me on my WhatsApp number so I'll be able to answer your questions. Okay? Okay, Zainab Adoke, can you chat me on my WhatsApp number? You say you have an accident 20 years ago and you're having serious pain in your hips. Alright, what you need is Active HA and Forever Move. Active HA, Forever Move will help you very drastically, okay, to reduce that pain. The noise is getting too much. So chat me on my WhatsApp number that is pinned on the screen and I'll be able to get back to you. Thank you. Bye.